everyone, welcome back to my YouTube channel, APGAR Nursing Studio. In this video, we will be learning about APGAR Score, its importance and application in clinical practice. So stay tuned. Let's start with introduction. It is a simple standardized tool that helps us to assess neonate well-being soon after the birth and also reflects how the newborn is adjusting to life outside the mother's womb. This assessment also helps healthcare practitioners in their decision making so they could quickly tell or analyze if a newborn needs immediate medical care or not. Here's a throwback on origination and history of APGAR Score. This method was endorsed by American College of Obstetrician and Gynecologist and also by American Academy of Pediatrics. Moving a bit into the history, it was originally designed in the year 1952 by Dr. Virginia APGAR, an anesthesiologist at Columbia University. It was designed to assess the need of intervention to establish breathing of newborn at 1 minute of age. Infants are rated on a scale with a score ranging between 0 to 10. We need to understand this. The higher the score, the higher the well-being of the baby. This means the score should be higher in number, suggesting that the baby is well adjusting in the external environment. Now, question arises when and how many times we have to assess the baby using APGAR score. It is important to know that it is assessed twice. First at 1 minute of age and other at 5 minutes of age. If the score is less than 7, it can be repeated again after 5 minutes duration gap till 20 minutes of age. A score of 10 at 1 minute means that the newborn is well adjusting to extrauterine life. Now let's understand the APGAR score. It has 5 parameters which can be remembered by the mnemonic APGAR itself. A stands for appearance, P for pulse, G for grimace or reflex irritability, A for activity or muscle tone, and R stands for respiratory effort. Each parameter is weighed evenly and assigned score 0, 1 or 2 depending on the observed condition. The parameters are then added to give the total score. The resulting APGAR score ranges between 0 to 10. Let's discuss each category one by one. The first parameter is color or appearance. If the neonate is pale or blue, the score given will be 0. If the infant is pink but the extremities are blue, the condition, otherwise also known as acrocyanosis, the score for color given is 1. If the neonate is entirely pink, the score given will be 2. The next parameter is the heart rate. The heart rate is evaluated with a stethoscope or an electrocardiogram. If there is no heartbeat, the heart rate score given is 0. If the heart rate is less than 100 beats per minute, the heart rate score given is 1. If the heart rate is more than 100 beats per minute, the score given is 2. The next parameter is Grimace response or reflex irritability. In a neonate with no response to stimulation, the reflex irritability response score given is 0. A neonate with minimal response to stimulation or with minimal grimacing, the score given is 1. In a neonate who cries, cough or sneezes on stimulation, the score given is 2. Then comes the muscle tone or activity. In inactive neonates with loose and floppy muscle tone, the score given is 0. In neonates with some tone and flexion, the score given is 1. The neonates who are active in motion with a flexed muscle tone that resist some extension, the score given is 2. The last parameter is the breathing efforts or the respiration efforts. If the neonate is not breathing, the score given is 0. If the respirations are slow, irregular, weak, or the neonate is gasping, the score given is 1. If the neonate is crying vigorously, the score given is 2. After assessing all the parameters, newborn comes up with some score. The maximum score obtained is 10 and minimum score is 0. The score of more than 7 is considered satisfactory and indicates adjustment to extrauterine environment. The score between 4 to 6 indicates moderate distress and score of 0 to 3 represents severe distress.
Now let's understand the interpretation of APGAR score and the management regime. If the score obtained ranges between 7 to 10, it is considered normal. It suggests that the baby is doing well and there is no need for further intervention. Only monitoring and routine activities can be carried out. If the score obtained falls between 4 to 6, then the newborn is moderately asphyxiated. This means that the newborn baby needs help with breathing. Various interventions like clearing the airway, giving stimulation, support with oxygen therapy can treat the moderately asphyxiated newborn. If the score obtained falls between 0 to 3, that means the newborn is having severe asphyxia or is in severe distress. So, immediate resuscitative measures needs to be taken. This can be handled by means of ABC, that is, airway maintenance, establishing breathing by mask and ventilation or oxygen support, and circulation by chest compression. Also, if there is a need for intubation, then the newborn may be intubated as well. As we have gained much knowledge about APGAR score, let's apply it now. We are given with a scenario which states that a newborn baby is delivered in a hospital setting. The healthcare provider immediately administers an APGAR score to assess the baby's overall health and determine if any immediate intervention is needed. We are given with following parameters. We have heart rate, which is 80 beats per minute. We have respiratory rate, that is weak and irregular breathing is there. We have muscle tone, which shows some flexion of limbs. Then we have reflex irritability. The infant shows grimaces in response to stimulation, and the color of the baby is, we have acrocyanosis, that means the baby is having blue extremities. We have read the scenario, we have all the parameters with us. Now how we will score the baby? Now let's score the baby in the scenario based upon the table that we studied earlier. So we are given with this set of parameters. One of the parameters that we are given is color. In the scenario it is mentioned condition called acrocyanosis or blue extremities. So as per the table, the newborn will be getting score of 1. The next parameter that we have is heart rate. In this scenario it is given that the newborn is having 80 beats per minute. So as per the table, the newborn will be getting a score of 1. The next parameter that we have is reflex irritability. In this scenario, the newborn shows grimace in response to stimulation. So, looking into the table, the newborn will be getting again a score of 1. And what about muscle tone? It shows some flexion of limbs. So looking at the table, again the newborn will be getting a score of 1. The last parameter that we have is respiratory effort. In this scenario, it shows that the newborn is having weak irregular breathing. So looking at the table, the newborn will be getting a score of 1. When we sum total the scores of all the parameters given, we come up with a score of 5. So an APGAR score of 5 indicates that the newborn is in moderate distress and may require immediate medical attention. In this video, we learned about the introduction, history, and application of APGAR score. Now we know that APGAR score is a valuable tool for assessing a newborn's health immediately after birth. It helps healthcare providers identify babies who may require immediate medical attention. If a newborn gets lower APGAR score, it may be concerning, but it is important to know that many babies with lower APGAR score can lead healthy life, provided timely intervention being delivered to them. So this was all about the video. Thanks for watching.